Hi everyone, welcome to another episode of GLANZ Wellness Podcast, where I discuss everything aesthetics, when it comes to skincare, how to rejuvenate the skin, how to optimize our hormones, or all sorts of injectables. I am here to answer any questions you may have, so thank you in advance for sending all your questions every week. And we are here every week. This launches on Thursdays at 12 noon. The way that we do this podcast is I answer the questions that you guys send every week, and I'm going to be reading them out loud and answering what I think it's in your head and what you're thinking and how it's done. First question. How do you personalize treatment plans for patients based on their individual skin conditions? That is a very important question. So what makes me different from the rest of the providers is that I don't have you come into the office and treat you the same way I would treat any other patient. When you come in for consultation, I talk to you about what are your skin concerns, what you want to improve. I try to see what is your availability for having a procedure, right? So how much downtime do you have? Are you somebody that works on TV and has no downtime? Or are you okay with having 5-7 days of downtime? Also, what it is that you want to achieve. Do you want to minimize wrinkles, improve pigment, what skin tone you have, right? So I don't treat patients with Fitzpatrick or skin tone type 1 versus skin type 4. I do have lots of lasers in the office and different devices that treat a lot of the skin tones, but that is key in deciding what treatment and what service you're going to get so that you can get the best results. The consultations are going to be with me. It's going to be around 15 to 20 minutes where we're going to discuss what is it that you want to achieve and how I can help you get what you want. Question number 2. What are some of the most effective treatments or procedures offered at GLANZ for addressing age-related concerns? Okay, another great question. When it comes to age-related concerns, what do we see as we age? So one of the very common concerns that I see as a provider is sunspots, right? Sun damage, especially in Miami, but I think anywhere in the world. We are exposed to sun, and let's be honest, not everyone uses their sunscreen every day. So what happens is that accumulation of sun creates little sun damage or sunspots that come out after years of sun exposure, and they look like pigmentation or freckles. Some of them can be tiny, looking like a freckle. Some of them can be actual patches that you can see on patients' cheeks or their forehead. Those are the areas where you get the most common sunspots. It can also happen on our hands. So always remember, you have to apply SPF to your hands as well. So when we talk of another skin concern is wrinkles. So as we age, wrinkles are a common part of our facial expressions. So if we raise our eyebrows or we smile, obviously we create some folds on the skin that are going to cause wrinkles as we age. And another concern is elasticity, right? So how laxity or how tight our face or skin looks. As we age, we lose fat from our faces, our under eyes, our cheeks, and our lower face. And then what happens is our skin just droops down. That's what causes the jowls that we all hate. And if I try to stretch my skin, when we were younger, the skin would stretch right back. But what happens as we age is we lose that elastin and collagen from our skin. So getting a treatment that works for that includes not only laser therapy, so rejuvenating lasers or resurfacing lasers helps stimulate collagen, improve elastin. It helps with skin tightening, right? We have a laser here in the device here in the office called the Opus Plasma with radio frequency. Radio frequency is going to heat the skin to make that create more elastin, so that when that bounce that the skin has is the same as when we were younger, and that lifts and tightens the skin so that it creates a more youthful appearance. We also have lasers here at our office that treat sun damage, and another major skin concern that our patients come in, especially Hispanics here in Miami, is melasma. Melasma, as we know, is a problem with our melanocytes, where our melanocytes are getting stimulated too much and they throw pigment out on areas that we don't want on our skin. And you can see it as an uneven patch, whether it is on our cheeks, our forehead, our upper lip is a very common place as well. And obviously, this is something that we can treat, but it's something that never goes away. Melasma involves lasers, it involves skincare, and it involves a lot of maintenance. We try to tell our patients to avoid the sun and use physical SPF, but obviously there's lasers that can accelerate how the skin heals. I have a laser here, which is a Q-switch laser that has it creates shock waves that are going to break the pigment so that you can absorb it and the pigmentation goes away. But the most important thing is patience, consistency, and using the products of maintenance at home. Our third question is the following. Are there any specific skincare products or ingredients that you recommend to promote youthful skin? Yes, there's a few ingredients. So when we talk what prevents aging or what helps with reversing aging, there's a few major products that everyone should be using. One of them is sunblock or SPF. SPF is very important not only to prevent aging, but also or sun damage, but also to prevent dehydration of the skin. Dehydrating our skin is going to prevent that collagen from fully forming, and dehydrating our skin is going to ruin our texture. Our skin is going to look dull. So to prevent that, I recommend you use SPF every morning, but reapply. It doesn't matter if you're inside the house because we still have the windows outside where the UV rays come in. You reapply it every 2 to 3 hours to ensure that your SPF is always active. If you, for example, if you're a female and you're wearing makeup, then I recommend that you get the powders we have here at the office from the company Zio. Those SPF powders you can reapply on your skin without ruining your makeup. SPF is number one. Number two is retinol. Retinol or tretinoin are derivatives of vitamin A. And what they do is they promote cell turnover. So promoting cell turnover increases our collagen production, increases our elastin, and it helps you make new skin that's going to look bright and refreshed. Retinol or tretinoin, they will cause for you to flake or peel a little bit. That's very normal. It doesn't mean you're allergic. But what is going to happen is that flaking out that old skin is going to help you have new skin that's going to be bright and look younger. And the other products that you can use, which these are all adjuvants that you can do, you can utilize in your skincare line. One of them is vitamin C. We know antioxidants help with eliminating free radical damage and things that are going to affect our cells and are going to kill our skin cells faster. So antioxidants are great. Vitamin C obviously helps with reducing and minimizing pigmentation. And the other thing is growth factors. So there's a few products that we have from different brands that have plant growth factors or human growth factors. Growth factors basically stimulate collagen to be active all the time. They increase hydration and they make your skin look younger. Next question. How do you stay updated on the latest advancements and research to provide the best possible care for your patients? That's a great question. Us as providers, we know in the aesthetic industry, every day there's something new that pops up on our Instagram feed, and we don't know, is this real? Is this not real? Is this approved in the US? Is this more in Europe? So it's always important to have a provider that is constantly studying the market and the industry and making sure that the products that you see on social media are safe and effective and they are approved in the US, because you don't want to do something here that nobody knows about and then we can't fix it. So always make sure that your provider knows enough about the treatment and has enough experience to help you achieve your results. We do this by going to conferences or different events. So if you look at my social media, I'm always going to either dinners to see new devices. I go to conferences around the US to make sure that I can stay updated with the new trends, because updating our knowledge, we don't do this only in medicine, but also in aesthetics. Updating our knowledge helps us not only bring the best treatments to our patients, but do it in a safe and effective way so that our patients have the best in the market at all times. And the last question, what is recommended for maintenance after finalizing a laser treatment? As we know, if we do a series of 3 to 4 laser treatments, which is recommended if you've never had a laser treatment, you're going to come for a consultation and I'm going to recommend the best laser. But lasers are working on your skin and they work slowly. We're stimulating your own cells and your own collagen to make new skin. So this takes time, especially if we're treating skin tightening. So if we're treating skin tightening, we have to give those cells a break to tighten the skin so that it looks refreshed and young. So what happens is when we're treating the patients with our lasers, a lot of patients ask me, is this a one and done? Once I'm done with the treatments, when do I have to do it again? Do I even have to repeat this treatment again? As you know, we are aging every year. So our collagen percentage goes down every year, and that is normal. As we grow older, obviously, we not only age and our cells start dying, but we're exposed to sun and pollution and all the lights that you have around you, like your computer, your cell phone. That's called blue light. That also creates sun damage and stress on our cells. That is why it's important to do laser treatments and skincare combined and keep up with your facials, which are the ones that clean your pores, stimulate collagen, and increase hydration. But for that to be maintained, not only you do your skincare at home, but also come in for our treatments. We have a membership program. Once you are done with your lasers, our membership program here at GLANZ ensures that you continue to giving your skin some love so that you can maintain those results. You're spending money getting some lasers to rejuvenate your skin or correct imperfections, and we want to maintain those results. So here, not only I am going to recommend amazing products to you, but the esthetician is going to make sure we can do different facials that do dermabrasion, increase hydration. Some of the facials that we have here work with oxygen therapy. We also have an LED light that our patients come in around once a week. It's a console that we put right on top of your skin. You relax. It's a procedure for 30 minutes. No pain, no downtime. Our red LED is going to decrease inflammation, stimulate collagen, decrease redness, decrease breakouts. Those things are minor things that you can do to maintain your skin and your optimal results after you're done with your laser sessions. To end this podcast, I always love to finish the podcast with a quote. I have two today. One of them is, skincare is healthcare. We know if we're sick and we're having some symptoms, let's say we have joint pain, abdominal pain, vomiting, we right away go to our doctors to see what's wrong and how we can fix it. The same way we have to treat our skin. Our skin is the largest organ in our bodies, and we want to make sure that we keep it safe and healthy so that when we're older, in our 50s, 60s, 70s, we not only look amazing, but are living the best life that we can, because it's not only about looking amazing, it's feeling amazing as well. So here at GLANZ, you're going to get a protocol not only for your skin, but we also try to give you a protocol for your hormones, IV hydration, and also if, for example, you're looking for weight loss because you want to be healthier and you want to exercise, we can do that too here at GLANZ Aesthetics. So it's important, very important, to take care of ourselves and our skin. The other quote is, beautiful skin starts with great skincare. Sometimes the patients come in and they ask a lot about laser treatments, but one key thing that we can be doing ourselves in our houses is skincare. Something that we can do at home to make sure that we maintain our results. Like I said earlier, it's doing our skincare. Here at GLANZ, we're going to recommend not only laser treatments, but your maintenance program for home. And it's just being consistent. It is hard sometimes. We're tired. We don't want to do our skincare regimen at night. But it is key when you see people, like famous people, that are showing their faces on their skin and everyone's like, oh my God, is that a filter? Is that real life? You can have filter-like skin if you follow our instructions. That is key. And definitely we can start with a very simple skincare regimen and start getting you used to skincare and getting used to the routine. And then we'll start adding as we go to make sure that you get the best and most optimal results. Thank you for joining this week. Next week, we're going to be again talking about a very interesting topic. So send us your questions. And for those who sent the questions this week, thank you very much. Don't forget to join our lives on Thursdays as well at 12 noon. Have a great day.